Hello and welcome to the week with me, Pooja Avasti. This is episode 7 of Undoctored. Undoctored is a space where the experts speak your language on all matters health. You know that there are doctors and specialities and specialities, but there is one kind of doctor who's called a doctor's doctor. Who exactly are we talking about? Please welcome with me Dr. Manish Mohil, who brings with himself 35 years plus of experience. He is the head of internal medicine at the PSRI Multi-Speciality Hospital. Hello and welcome to the week, Dr. Mohil. We're happy to have you here on Undoctored.
Thank you, Pooja. Thank you for having me here.
So let's start at the very start. I know if my heart has a problem, I have to go to a cardiologist. If I need to get something wrong with my bone, which doctor I have to go to. But who exactly is an internal medicine specialist?
Well, in internal medicine, you can call in our context, especially in the Indian context, an internal medicine person is a physician who has specialized in dealing with what you can say non-medical, non-surgical illnesses. In our context, you can say internist is the one who deals with non-surgical problems of adults.
Right.
So yes, please.
So this would encompass all kinds of non-surgical problems then?
Initially, yes. Although there are now with the increasing specialization, you see there are branches and subspecialties which have forayed into each of medical specialties. But yes, by and large. So, for example, internally, yes, please go on. Will.
No, please go on, Dr. Moy.
So, for example, this is the initial point of contact, in fact, with the patients with medical problems, be it a cardiology problem or a gastroenterology problem, and so on. The list is wide.
Right. And are internal medicine specialists the same as primary healthcare givers, or they are more specialized than them?
So the internal medicine doctors have a postgraduate degree in medicine, in
Right,
internal medicine or general medicine.
right,
In contrast to the general doctor or general practitioners who are graduates, MBBS or graduates.
right. So, do you deal with only problems that adults have, or would you also be treating children?
We deal with the problems only with adults.
So, which means that you have to have a very comprehensive overview of all human organs and the possible problems that they could be having. Do you also have a role to play in preventive medicine?
We do, and that would amount to basically screening for diseases, the health check, the preventive health checks, which are very now popular these days, as well as the prevention of diseases, for example, adult immunization.
Right,
So that also falls into the field of internal medicine.
right. So, would a layperson know that he or she has to come to you, or they first go to a specialist and then they are referred to you?
By specialist, you mean the somebody like cardiologist or
Yes,
gastroenterologist?
yes.
Usually, it is and should be the other way around, Pooja. So, internal medicine person should be the first point of contact with person. Suppose somebody is coming with chest pain, for example, or pain in the tummy, and things like that. So, causes can be many. Chest pain can have varied, basically, causes. So, it is for the internist or the internal medicine person to figure out and see what is the reason, what possible reason, and then refer to the concerned super specialist.
Right. So now there is a trend generally of super specialist of us always consulting super specialists, and somewhere the general physician or the internal medicine specialist has become sidelined as far as our approach to medicine goes. Um, so is that changing a little, or what can the medical community do to change that a little?
I think for a comprehensive and methodical approach would be to go to an internist first and then basically foray into the other specialties. Because an internist has what you can call a bird's eye view of the problem. So
Right.
he has so he after evaluation and is this thing he can refer the patient to different subspecialties or subspecialist or super specialist if need be.
Otherwise, you will be treating the patient if there is no need to go to a super
Yeah,
specialist.
as I said, this will depend on the cause. Suppose somebody has a cause like chest pain, for example. Now, chest pain can be because of heart attack. Chest pain can be because of some lung problem, or a simple muscle pain can present as a chest pain. So it is for the physician or internist to basically figure out and see. If yes, the reason is cardiac, then the patient goes to the cardiologist.
And if there is a web of problems that a patient has, and let's say that it's not a cardiac problem or it's not a problem with my kidneys or my liver, then I would stay under your care for a long period of time then?
If it is a multi-system problem, for example, involving cardiologists, gastroenterologists, so on, so therein the role of internist would be a sort of a coordinator, role of a coordinator, you can say, just like
Right,
the conductor of an orchestra and so on. So to coordinate between the various subspecialties. So that is one part.
right, right.
I did not get your question regarding the prolonged care.
No,
Please come out.
what I meant was that if let's say I have chest pain, but my chest pain is not related to any kind of cardiac problem, and let us say I also have some issues with my liver, but not necessarily something which requires a super specialist. So then I will stay under your treatment for as long as it takes, right?
That's right. That's right. And whenever I think that it is right for you to go to another subspecialist or what we call super specialist, then I refer the you or the patient to the concerned specialty.
Right. So you did talk previously about that there are many specialities within internal medicine also now. So
Yes,
could
there
you
are.
tell us a little about that as well?
Well, to name a few, see, cardiology related to the heart problems, gastroenterology related to the problem of gut and liver, endocrinology, which deals with the hormones, pulmonology, dealing with the diseases of lungs, and so neurology. So these are the basically the initially they were the branches of internal medicine,
Right.
and now have become because of the increasing knowledge and increasing complexity of the modern medicine. They have got each of them have gotten a hold of themselves, and they have become a basically a subject unto themselves.
Right, right, right. And you did mention that the term internist is basically an American term.
They say internist, for example, and Britishers say physician or general physician, in contrast to general practitioner, as we discussed previously.
Right. Now, is the popularity and knowledge about internal medicine or a general physician growing, or no? I mean, we are so focused on specialists that we are not paying attention to them. Like there was a time when every family had a family doctor who we used to call, but
Right.
now that
Right.
concept seems to have vanished.
I don't think it has vanished. I think with increasing, you see, branching into various subspecialties, even there, this thing, for example, cardiologists also. There are some interventional cardiologists, there are non-invasive cardiologists, and people dealing with the rhythm disturbances. So the role of an internist becomes all the more important now than ever to guide the patient or guide the person properly as to which branch to go to or which
Right.
specialty to go to.
So you do treat adults, you said. So that would be 18 plus years or
It is.
even.
And it varies actually. Some places it is 16 plus, at others it is 18 plus.
Right. So we know that when people go in for a comprehensive checkup, there are often so many tests prescribed for them that it's confusing for a layperson to make sense. So could you just like give us a basic thumb rule about what kind of tests should we be having in our annual medical checkup?
So this the basically the package that we have for checkups nowadays, this is fixed, more or less fixed. And what was let us say 50 years back considered to be an elitist kind of a test has now become commonplace.
Right.
A thyroid function test, for example, in maybe 50 years ago, would have required this thing, lot of preparation and so on. But now it is a part of general and routine check.
Right.
So the package would generally include blood tests, wherein a hemogram, a liver function test, kidney function test, thyroid function test, lipidogram, that is the lipid profile, blood sugar, they are there, and a urine routine test and basic imaging like ultrasound. So I'm talking of the general, I mean, the health packages, the health preventive health check packages that
Right.
we
Right.
have. And then there are packages for women, for example, those they may involve getting a mammogram done and a pap smear and so on.
Right. So one of the qualities that you have is that you have a bird's eye view of all these organs that we have. What are the other qualities that make for a good internal medicine specialist?
An insight into the basically because we have to coordinate and look at broad knowledge, broad basic knowledge of different subspecialties that we talk about, whether endocrinology, neurology. So basic knowledge. I mean, I may not be as knowledgeable about endocrinology, for example, as an endocrinologist, but then I would be able to catch as to what is wrong with the patient and what is the problem. So, as a diagnostician, I would say more as a diagnostician.
Right. And as one ages and problems purely related to age, which might not be requiring a specialist, so you would be the right doctor to come to?
Geriatrics, yeah, the field is called geriatrics.
Yes, but if
Dealing with the
I don't have
special needs and the special problems of the elderly, and
right,
the internists are the one who look after
right.
this population, this subpopulation.
Now, there is one issue about testing. It is often said that all these limits that are prescribed or all these parameters, they are more attuned to a Western population. But would you say that measures of hemoglobin or lipid profile now are, for us, are same as Western populations?
Though, no, they are not, but I think most of them have gotten standardized according to the Indian population. There were lots of studies now wherein there is some variations in some parameters. Some are, of course, like sugars and all are internationally recognized. That holds true for everybody.
Right.
But then there are others like, yes, lipids and so on. So we have like in our country, the racial and ethnic and other genetic differences make us slightly different. That holds true for every population. So that is taken into account while prescribing the standards for each test.
You come with 35 plus years of experience. In all these years of experience, how have you seen the kind of problems that we Indians are facing change? Plus, uh, what is the gender differential in these problems that you are now seeing?
Well, over the years, first of all, before coming to the problem, awareness has increased.
Right.
This is what I feel. Awareness in the public has increased, and therefore, we were just talking, the importance of internal medicine also has increased. So, and as far as the disease spectrum is concerned, now we are getting, because of the awareness primarily, we are getting, for example, cardiac diseases. Even in the young also, we as all of us are aware, there's increasing prevalence of cardiac disorders in the young. So that is one. Plus, over the years, the incidence and prevalence of diabetes has increased. So these are basically hypertension. Hypertension is very common, and also perhaps because they are now increasingly recognized.
Right.
So that is one, because the diagnostic tools are more readily available, they are more refined. So that could be one reason. But yes, these are the.
What are the gender differentials that you see? Are men facing some problems more than women in all these years of experience that you have? Are women facing some other kinds of problems increasingly?
So, for example, certain diseases like cardiac diseases and strokes, they are more common in men. Perhaps because of the protection that is provided by the hormones in the women in their childbearing age. So that is one reason. So incidence of, for example, cardiac disease is less common in women than in men. Although with the changing lifestyle and with modernization, I think this gap has narrowed a little. So,
Right.
plus there are diseases which again are more common in women. For example, certain autoimmune diseases they are more common in, and the rheumatology disease they are more common in women than in men. Some of them, many of them.
In fact, you make an interesting point there about autoimmune diseases being more common in women. Is this also related to the fact that women are psychologically geared to perhaps not deal very well with themselves and take on the responsibilities of the world and the families and not care so much about their health, because of which their immune systems in turn are weaker?
Psychological factors play an important role in several diseases, almost all of them, maybe as as a secondary this thing also. But for most of the rheumatology and immunological diseases, we have a definite molecular basis now. So, which is gender based and which may not necessarily be related to psychological makeup of an individual.
Now, you did speak about genetic factors, but what about environmental factors? Do you see that they are also increasingly playing a role in certain kinds of diseases or impacting certain organs much more now?
Definitely, definitely. With modernization, you see, with urbanization now, we have pollution is one thing. So all these are environmental factors are pollution, lifestyle habits like smoking, alcohol, sedentary lifestyle. You see, these are actually uh, are basically you can say lots of lifestyle diseases are caused by, or to some extent they are triggered by these factors.
Right. Now, you, of course, are in the NCR region, but do you also see a rural urban divide in the way Indians are now falling sick?
Yes, certain diseases are the so-called urban problems. The urban diseases like hypertension, uh, heart disease, cholesterol, I mean the dyslipidemias, they are more commonly seen in the urban population. Again, as I said, because lifestyle has a lot to do. But with increasing, you see, even the rural population, they're getting exposed to the so-called bad effects of environment. So the gap is now narrowing. We see more and more of rural population also coming with these problems, lifestyle-related diseases.
Right. What are your top five tips so that I don't have to go to a doctor at all? Of course, sedentary lifestyle you've already mentioned, and you've mentioned the environmental factors. And besides that, give us top five tips so that I don't have to come to a doctor.
Yes, exercise, so avoid sedentary lifestyle. So nobody can actually say that, well, these are the guarantees you don't have to, but yes, your chances of falling will substantially reduce. So, sedentary lifestyle, yes. Regular exercise habits, for example. Uh, Avoiding smoking and drinking, maintaining proper weight, and controlling the disease. Regular visits to your physician for controlling the disease that you already have.
What is the frequency of testing that you refer you would tell your patients to go in for after certain ages, like after the age of 30 when should I have my checkups, after 40 when should I have my checkups, at what interval?
Hmm. There are no specified, but yes, one can say, for example, a person in their 30s can have a thorough checkup or the preventive checkup done once every 2 years or so.
Right.
And as the age increases, you see the incidence of the diseases that we just talked about also increases. So the frequency becomes unlike after 50, we say health checkup every year. And and some cardiac tests maybe every other year, once in 2 years, should they be negative, like exercise, stress testing, and so on.
Right, right. And of course, gender specific testing. Women should go in for, let's say, pap smears and the other kinds of tests that they are. Finally, tell us something about an internal medicine specialist that common people don't know at all. Like, for instance, I'll give you an example. We don't know that they are, unless and until we go for an operation, we don't know that there are different kinds of anesthesia that can be given. For instance, I might be having a choice of do I get a block anesthesia or do I get some kind other, or do I go in for a general anesthesia? So, similarly, something about internal medicine that common people don't know, non-medicos don't know.
No, I think, I don't know how to actually basically put. So they are the ones to go to for your basically all non-surgical problems for proper guidance. You see, they're more like to guide you into various specialty to go to. If I am able to get I'm not sure
Right,
whether I've
right,
gotten you
right.
right with the anesthesia example also. So
Right. So, which means we should know that if we have a general kind of a problem, the first kind of doctor to go to is an internal medicine
should be an
specialist.
internal medicine. Yes, yes.
Yeah.
Suppose you have abdominal pain, your pain in the tummy. We do not know what is the reason. Likewise, the chest pain, sort of a non-ominous kind of chest pain, or a fever, for example. Right, left, center, we deal with fever. So fever, so you should, the internal medicine person is the one you should go to. One should go to.
One final question. You said that you also have a role to play in adult immunization.
Yes.
So, what kinds of immunization are we talking about then?
Well, we are talking about immunization. First is the immunization program in the pediatric age group. So that is
Right,
defined and well set. So here we deal with the problems or the diseases which are preventable by vaccination. For example, influenza is a
right,
vaccine very
right.
common. Pneumococcal vaccine for preventing some pneumonias, bacterial pneumonias. So that is under the thing of internal medicine. Then we have now Shingrix or this herpes zoster vaccine.
Right.
Likewise, other vaccines in the adults, for example, rabies vaccine, tetanus, and so on. So they are under the they are basically looked after by the internist or the internal medicine.